coronavirus outbreak has happened in India, a lot of efforts are being done by the doctors across the country. We have with us one of the pioneers of the task force against coronavirus, Dr. Guleria, who is the director of All India Institute of Medical Sciences and a pioneer and a very key part of the task force which is combating the COVID-19. Welcome to AIIMS, sir, first of all. Sir, what is the trajectory that we are seeing today as we compare to the world, that since we have completed a 21-day lockdown and afterwards we are into the second phase of it now? How well do we compare with the world?
So in my mind, the trajectory is quite satisfying, because if you look at the number of cases, they seem the doubling time is slower, and we haven't seen a steep rise in the number of cases as we've seen, as happened in Italy or Spain or in the US. And in some parts of the country, actually the number of cases are declining. So I think the lockdown and the aggressive action that has been taken are showing their effect now, and we are having a plateau now in terms of the number of cases. And also, if you start looking at number of cases in critical care, they are not that many, and it is not causing a huge strain on the health resources of the country.
The second question is, how do we see the mass testing in place, and what all can be done to conduct these mass testing? Can technologies like AI be implemented, and what is the future of this mass testing over fighting this coronavirus outbreak?
So mass testing or testing to a large scale should be done to answer a particular question or collect some data to be able to help policymakers take a decision. It cannot be something which can be done just like that because someone feels that he should get himself tested even if he has no symptoms. Secondly, there is a lot of technology which is coming in. We already have a point of care test which is antibody based. I think over the next few months we will have new kits which will come in, which will give us results much more faster at the patient's bedside and will help us in this battle in a big way. Currently, the gold standard continues to be a nasal swab or a throat swab which goes through RT-PCR, and then the results take some time. The machine also is complicated and it needs to be done with a lot of biosafety. I feel that with a lot of research going on in the next few months, we will have better kits. We are already having the antibody kit which India has started using now. The RT-PCR kit testing has been ramped up significantly. So hopefully in the next few weeks we will have new tests also.
We've seen that a lot of times, or maybe a fewer times, when the RT-PCR is not able to judge. So is only RT-PCR the gold standard, or we have something higher in this?
So currently the gold standard continues to be RT-PCR, which is basically looking at a nasal and a throat swab. And in patients who are symptomatic, who have the virus in the nose and throat, it has a very high specificity and a very high sensitivity. It continues to be the gold standard.
Next question is, we've seen that the HCQ drug is being given to the doctors working in high-risk environment. First of all, what is the reason behind it? And do we see that this is reducing the viral swab, or what we call the viral effect of the virus?
So the hydroxychloroquine, which is what HCQS is a drug which has been used for many decades by physicians for immunological disorders, we call connective tissue disorders, arthritis and all, and has been found to be very safe. There are some studies, although data is very limited, experimental and some clinical data, which shows that by giving hydroxychloroquine, the viral load decreases and it may be useful. Based on a risk-benefit analysis, the expert group decided that in high-risk people, like doctors who have had a close contact, or doctors who are dealing with COVID positive patients, or attendants who have come in close contact with a COVID positive patient, could take this drug under monitoring or supervision by the healthcare professional for any side effects, and it may help in decreasing the viral load if they get some exposure and thereby not getting severe infection. So based on this hypothesis, it has been advised. There are a number of studies going on, not only in India but even abroad, looking at the utility of this drug both as a treatment but also as prophylaxis for healthcare workers.
Since you're a part of the task force, a lockdown has ended. We have gone into the mass testing stage also. What's the next big step which is being taken?
So currently the biggest step that we need to do is work on aggressive lockdown in hotspots so that we prevent large number of cases in these hotspots. At the same time, we improve our medical infrastructure. We should be ready if there is an increase in number of cases, whether it be ICU cases, whether it be wards where oxygen is required, and we make these facilities available. So working in decreasing the number of cases and decreasing the hotspots, and also improving the healthcare facilities so that in case the number of cases increase, we have the facilities to manage these patients.
While the health ministry is claiming that we have adequate amount of PPE kits with the doctors available and all the safety measures are also being taken, we still see that a lot of deaths of doctors is happening. What is the reason behind it? If you could tell us?
So doctors are always at a higher risk because of exposure, and it's important to understand this virus load increases in the subsequent days when the patient is in the ICU. And this is not only a phenomenon that we would see in India, this is a global phenomenon. A large number of doctors and healthcare professionals, even in Spain and Italy, have tested positive for COVID, and many have died, unfortunately. So there is always the issue of doctors taking extra precaution and as much precaution as they can. But if you have a very sick patient who suddenly crashes or collapses, sometimes doctors, to save the patient's life, move in very quickly, and they cannot therefore at times take all precautions that are required, because time then is very important. If you don't revive or resuscitate a patient at that point in time, the patient would die, and it is your responsibility to save lives. Sometimes that causes an exposure, and I think that could be one reason why doctors do get exposed.
Since you interact with CSIR, DRDO and other members of the task force, the research is going on. We know that CSIR is continuing the genome research on this. What has come out since now, and is it on the initial stage, or have we got something out of it?
So it's in the initial stage. A lot of research is going on. Either it's looking at genomics, proteomics, understanding the virus, understanding its other effects, looking at what it does as far as the disease is concerned, the cytokine storm, and whether there are other changes that the virus can cause. How is it affecting the body as a whole, not only the lungs but other systems. I think it will take a few months for the entire data to come out and publications to come out for us to really come to a definite conclusion.
Last and final question. A lot of attacks have been happening on the doctors. How do you comment on it, and what is your take on this?
So it's very unfortunate, because doctors and the healthcare workers are the ones who are putting their life at stake and managing these patients. I think people should rather clap for them and look after them rather than trying to attack them. I think there is just fear which is causing this to happen, and it's important for people to understand that these doctors and healthcare workers are not, they're part of society, yet they put not only their own life but the life of the near and dear ones at stake when they come to manage these patients, because the fact that they are dedicated in the field at managing, saving lives is important, and I think society should appreciate them rather than behaving in this manner.
So this was Dr. Guleria speaking to us. I am Randeep for